Right. So you had Kwame Sapong Esiedu, you had also Kwabena Minta Akando, and former Auditor General Daniel Domelevo speaking to us in those interviews. And the amount of 21 billion plus expenditure for the COVID period. That's the amount that we got from our various sources. And according to the Auditor General, here are some of the top highlights that we want to bring to your attention. Now, it says that 120.19 million was to UNICEF AVAT for the supply of 16.3 million vaccines. However, only 5.11 million doses of the vaccines valued at 38.232 million were supplied. So 16 million, only 5 million was supplied. Let's continue on. There is an outstanding amount, consequently, of 81.87 million with UNICEF AVATs. Then 607,419 was paid out of a total of, that's a million, was paid to contract for supply of 26 Toyota Hiace Deluxe ambulances. The contract was signed on the 1st of December 2021, and the ambulances were to be delivered by 15th January 2022. However, no ambulances were delivered as of 28th of November 2022, as they did the audit. Then medical equipment valued at 110 and 27,000 Ghana cedis were issued to a private hospital by name Christ Leeds and Specialist Hospital belonging to Dr. C.K. Amenu Veve in Medina. The hospital did not serve as a COVID-19 isolation center or did not receive any COVID-19 patients. So the hospital didn't receive patients. It didn't also serve as a center, and yet the money was paid. The Ministry of Information paid themselves a total amount of 175,500 Ghana cedis as COVID-19 risk allowance. The auditor says this was contrary to the risk allowances directive and without approval from the Office of the Chief of Staff. Then these, it says, are unaccounted for funds by some chiefs. Some monies were given to some chiefs. 451,800 were disbursed directly to paramount chiefs of the some traditional councils. These payments were unsubstantiated with relevant supporting documents. 2 regional houses of chiefs misapplied a total of 154,161 and 97 pesos. Then you had 5 million said to have been paid to Dredge Masters Limited for the removal of plastic waste without certificates of work completed. There is also the isolation center that issues came up of. The Ministry of Health entered into a 25-year finance lease agreement at a total lease value of 15.26 million Ghana cedis in 2020 to be used as a holding isolation center in Adaklu in the Volta region. The facility could not be used for the intended purpose, which resulted in an additional cost of 20.38 million Ghana cedis. Please note that, an additional cost, even though it wasn't used. So 20 million also went. Delayed projects, the 7 isolation and treatment centers being constructed at a cost of 158 million Ghana cedis had not been completed at the time of the audit. This is some 30 months after the construction had commenced. I think I can pause here so that we continue. We start the discussion and see where it takes us to. So I'll begin with Dr. Theo Acheampong. Thank you very much for staying with us. Your overview of this report, and I'm sure you are zeroing in on the infractions and what the corrective measures are supposed to be.
Yeah, Samson, remember you actually made a statement. Is this back to the same old ritual? Unfortunately, yes, that is what this report points out, that we have very weak systems to check spending, and often, we've been living pretty much like Arabian, princes and kings, in the sense that it's as though we are unable to account or fully utilize the amount that have been provided to us. In the midst of a crisis like this, or like COVID, as we saw, of course, speed was important and the government had to respond to the issues. But that did not mean that we have to sidestep the provisions that you have within the public financial management laws of the country. And you can see this pattern, whether it is COVID or whether it is the other reports that the Auditor General issues, that consistently our institutions, our agencies, our departments are able to spend without recourse to the laid down processes and the laid down procedures.
But at the time, we were made to understand that we should allow for some room because of the exigency of the situation. Don't expect people to follow the rules. The health minister was in Parliament.
I get that, but that doesn't mean that you need to sidestep the rules entirely. I mean, to the point that you're giving some money, so hospitals are being given money for literally next to no work being done. What I'm trying to paint us here is that at the core, the checks and balances that we have within our governance architecture is extremely weak. So all you then have to have is an event like COVID or any other sort of external event for you to now expose that strong weakness that we have within that core. Because the laws are literally not working. Those checks and balances are not working. So we keep collecting money, whether it is COVID money, whether it is IMF money, whether it is World Bank money, and it's still going into the same leaking basket, right? Only for us to get to a point where we say, well, we are not able to pay you, so we have to restructure our debt, like the conversation we had a few moments ago. That is the real issue that we've got to, in my view, address here. And to the point that we are not able as a people, as a government, to put in those safeguards, unfortunately, then we'll keep having these issues one way or the other. So what is the way forward? I think it is very clear. And even before I come to the way forward, another point just to highlight how lax this whole engagement has been. Go and read the press release that the Finance Ministry itself issued in relation to this report. Right. Paragraph 4, they say that, well, the ministry welcomes the report and wishes to assure the public that, quote unquote, steps are being taken to address all the issues, right? And they talk about asking the agencies to evaluate their actions to implement audit recommendations. And they talk about preparation of an emergency expenditure management guidelines. We have heard all these things before. Year in, year out, Auditor General's reports are issued. We hear things about implementing audit recommendations. It's been there. You can go back 20, 30 years, similar things, and still the leakages are happening. Still, we're seeing people getting away with, a theft of public money. That's not right. So I think we need to see the prosecutions happening. We need to see the OSP getting on top of some of the issues that have been highlighted in the report. But I think importantly, we also need to get the Auditor General itself to start implementing the surcharge and the disallowances. We've seen bits of that work in or when the past Auditor General was in power, and I'm looking forward to this Auditor General or the office, rather, let's not make it a personality, start implementing those surcharges and disallowances, because this is public money.
Right.
This is no.
Doc, look at the next slide that we are about to scroll for you on the screen. The Finance Ministry told us, the minister told us when he appeared in Parliament, that these are the sources from which we got the money that we used for the, COVID situation. Contingency Fund, World Bank Group, International Monetary Fund, Africa Development Bank, European Union, sale of BOG COVID-19 bonds, Korea sent us money, Germany gave us money, and the government of Ghana also gave us money. In all, 9 sources. His report predates this audit. Yet we have an audit that gives us 6 sources. What do you say about that? How do we now account for the money from Korea, Germany, and government of Ghana?
So what it tells you is that the extent of the rot is even going to be deeper if you account for the extra 3, sources, particularly the government of Ghana money, right? You even see a much deeper rot, much bigger infractions if one were to include all of those sources within that. And the point that I started off by making is that fundamentally we have a problem. And the problem is that we are sidestepping the laws, we are sidestepping the Public Financial Management Act, and everybody is doing their own thing. And it looks as though the institutions are not able to really be on top of their. In fact, it's not. It looks as though the institutions are not on top of their game. So we just keep pouring money into a leaking basket. So for me, this report is it's not different from any of the other Auditor General's reports that we've seen in the past. The last one we were made mention of almost was 17 billion or so unaccounted for, and there are other similar things in the past. So we need to strengthen the institutions, we need to strengthen the governance, we need to see prosecutions, and importantly, we need to get the regime of the surcharge and the disallowances, going. Other than that, we'll be here 6 months, 1 year, and we'll still be discussing the same issue.
Again, doesn't it come to you a bit, surprising that the requirement of the law is that these funds were to be audited every year? Now we have 3 years lump up, and there is an audit of all the 3 years.
Yeah, so that is not for me. It's a bit of an issue, but it's not really the big issue. At least the audit has been done, covering the 3 years. 6 of the funds or 6 of the sources were included, and the other 3 were not included. But the bigger point is that it tells us that we have a deeper problem and a crisis that we need to fix, which is the crisis of expenditure management and the crisis of having to spend within the remit of the law. And that is part of the broader national conversation we need to have as we actually go into an IMF program and start fixing the problems. Because these are the things that lead to the debt overhang and the issues where the government is not able to repay, right, its balances, and basically asking institutional investors and individual bondholders to take a haircut when you can see clearly that the government is really not doing enough on its part to plug in those, leakages.
Right. So what do we do about the unaccounted for funds that we receive from Korea, from Germany, and also from the government of Ghana? This is what has been accounted for, which totals almost about 22 billion Ghana cedis. What happens to that money?
I presume that the Auditor General may be doing a follow-on audit. I don't know. But if that is not the case, then we can implore on the Auditor General to complete or conclude the full audit. That's as best as we can do, given the
Can it be
circumstances.
explained away that the Auditor General missed these three sources of funds and didn't capture them and said nothing about them in the audit?
I haven't fully read the full report, so I'm not in a position to talk about sort of the assumptions that went into the inclusion of the six and the exclusion of the three. Perhaps the other panelists may be able to provide better insights on that.
All right. Thank you for that. Now,